Hello, my name is Abdul Mohsen. I'm going to talk about job satisfaction among the nurses. This topic is very interesting to me because I noticed that many times when I've been work back home in my country. To begin with, I want to talk a little bit about my issue. I have been worked as a registered nurse for about 5 years. I noticed the impact of job satisfaction on nurses' performance and on their behavior. Unfortunately, this issue leads to a wider effect such as stress, turnover, social problem, and much more. In this presentation, I would talk about this issue, why this issue is important for us as a nurse or for our health organization. What's the impact of this issue on us and how can solve this issue? And also, I will highlight on the positive outcome if we can notice by addressing and solving this problem. There are many factors lead or can be affect the level of job satisfaction. Among them, leadership, the style of the manager, the style of the supervisor, the working shift, night shift in particular, because the nurses, the night shift impact the nurses on poor sleep. Effort and reward, also it's very important. And gender, age, and marital states, all of these have been impact on the level of the job satisfaction. If we ask ourselves why job satisfaction is important, job satisfaction is responsible to cause burnout to the nurses. Job satisfaction impacts our emotion. It leads us to work under stress. Our relationship or our relationship with the supervisor will be conflict, and as a result, nurses will going to turn over. So I will discuss my experience with the job satisfaction. It's obviously law of job satisfaction impact me to be dissatisfied during the work. Occupational stress. I've been work under stress. I can't really focus on my tasks. The relationship, the work environment, law of moral. We cannot be work as a team or as a one team. All of these incidents or all of these problems will surely impact in my relationship with my family. And sometimes I get in conflict with my family regarding to these issues. Law of job satisfaction impact the staff nurses negatively as well. Staff nurses will suffering from the burnout and the stress, and their productivity will be decreased, and the malpractices could be happen, and the medication error will be happen as well. The relationship between each other will be affected, and the law of moral will be happen. Emotional exhausted could be happen. Law of job satisfaction impact the nurses' well-being, and as a result, some of them tend to smoking and drinking alcohol. So if they're doing that, they will suffering from the coronary heart disease, or maybe will suffering from the blood pressure. That's the impact of law of job satisfaction on the staff nurses. In this slide, I will discuss the impact of law of job satisfaction on our patients. Number one, patient will receive negative emotions toward them or toward their family. The quality and safety of the patient will be decreased because the nurses will be unsatisfied and will be under stress. The malpractice and medication error, which consider the most important one, will be happen. And also, by increasing the medication error, or by it might cause the death for the patient. So this problem will be wider effect, and it will threaten the life of the patient regarding to the law of job satisfaction. So what's the impact of law of job satisfaction or job satisfaction by general on the health organization? If the nurses receive law of job satisfaction, he will intend to leave, or he will turn over. The turnover costs the health organization too much money, because they are going to hearing, they are going to replacement, they are going to provide materials, some training for the new graduated nurses, and much more. So, for example, in the United States, the cost of the nurse turnover, it will be between $25,000 to $88,000. It's a big number. So if a health organization should pay attention on this issue to avoid some implication like this. Also, the community of the nurses will be impacted from the law of self-satisfaction. For example, the social problems will be increased. This is because nurses will get poor sleep, will be stressful, so he cannot manage his behavior. He will be in conflict, whether with his family or whether with his people around him as a neighbors. The nurses will cannot satisfy, if he's not satisfied with his family, he will impact him negatively for the people around him. So some of the people dealing with the nurses by this behavior, he will get bad impact on the nurses, and this will impact the reputation of the nurses as well. Of course, there will be many benefits will happen if we can address this problem. The first one, who will get benefit, the patients. Patient who will receive the high quality of healthcare services, and we can save his life and provide healthcare in safety manner. Nurses will retain and decrease the workload dividing the tasks and increase the productivity, and they can apply all standards of health quality rather than applying some of them. Hospital will decrease the number of hospitalization, and we save the money for training and hiring new staff nurses. The community, as I mentioned before, would witness a decreased social problem, and then people will live in relative peace and harmony, such as the family of the nurses and the people around the nurses as well.